Dr. Henry, last week you touched on some of the challenges of this wave, including that you were surprised by how soon we started to see the surge. Maybe another way of putting that perhaps would be being caught off guard. We've seen more health orders, more enforcement, but also record daily cases, record hospitalizations, and record deaths. So my question for you today, and it's more of a bigger picture question, in your view, how are we still trying to catch up, and what do you not have or not have enough of that you really need right now?
Yeah, that's a challenging question, and I don't think I said I was surprised. I think, I did say I was surprised. I was surprised by how early it started. So it was late August, early September when we started to see the fall rise in cases. I wasn't talking necessarily about the steeper rise we had in October. I was absolutely expecting that as we went into respiratory season, it was very likely that we would start to see increased cases. So what I probably, it's so hard to predict. If we look at the models that we were talking about in the spring for what could happen in the fall, they did start in September. So it all is, we learn as we go with this virus. Right now, what I would like to have is a whole lot more experienced contact tracers to be able to help catch up on some of the areas that we found challenging. And that's something that we did plan for, but we now recognize that we needed more than what we had planned for. These things are all things that we learn as we go. But I think the most important thing that I want right now that we need more of is people working together, understanding that we're in this together, that it is the road that we all have to go through, and that we can each make a difference in our own family, in our own neighborhood, in our own community, and that makes a difference for all of us. We do have light. We do have a way out of this pandemic, and we need now more than ever to focus on reducing our risk of transmission right now so that we can get to that point where vaccines will have come in, where the weather will change again and it will be less permissive or less transmissible, and we'll be able to start some of those activities again that we so dearly need and hold in our lives.
Do you have a follow-up, David?
Yeah, a question from my colleague Shannon Patterson on restaurants. So you've asked people not to socialize. That includes dining out with anyone who doesn't live in their household. You've touched on this in the past, maybe a month or so ago, but are you expecting restaurants to enforce this? If 6 people show up, should they ask? Should they verify? Is the onus on the restaurant? If that's not practical, what do you envision?
I think the onus is on all of us to do the right thing. And that goes to a number of different things. We've heard that people are giving people in restaurants a hard time again about wearing masks, about not table hopping, about staying to 6 people. These are all things that are important to protect the people who work in that environment as well as us as individuals. So the onus really is on us. Go out with your family, go to a local place, but follow the rules. And that protects us all and keeps us all safe and allows the restaurants to provide meals for those of us who don't have time to cook this COVID times. But, this is a really important thing. We see the same thing with the mask mandate. If you are somebody who does not believe in masks, then don't go to those stores, because don't put other people at risk. And go at a different time, shop online, find other ways to do what you need to do. And for people who truly cannot wear a mask, find ways that we need to find ways to accommodate people, but we can do that without taking it out on the people who are working in those environments, because this is about keeping them safe and keeping all of us safe.